Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Testosterone replacement therapy. We discussed the possibility that erectile difficulties could be caused by low testosterone levels. And we stated that we would put together a separate video to cover testosterone replacement therapy. Testosterone levels generally peak during adolescence and early adulthood. As you get older, your testosterone level gradually declines, typically about 1% a year after age 30 or 40. It is important to determine in older men if a low testosterone level is simply due to the decline of normal aging, or if it is due to a disease called hypogonadism. Hypogonadism is a disease in which the body is unable to produce normal amounts of testosterone due to a problem with the testicles or with the pituitary gland that controls the testicles. Testosterone replacement therapy can improve the signs and symptoms of low testosterone in these men. Doctors may prescribe testosterone as injections, pellets, patches, or gels. Declining testosterone level can cause changes in sexual function. This may include reduced sexual desire, fewer spontaneous erections, and infertility. There are also physical changes. Various physical changes are possible, including increased body fat, reduced muscle bulk and strength, and decreased bone density. There can also be emotional changes. Low testosterone may contribute to a decrease in motivation or self-confidence. You may feel sad or depressed, or have trouble concentrating or remembering things. Testosterone replacement therapy is available in several forms. All can improve testosterone levels. Skin patches, also called transdermal. Androderm is a skin patch worn on your arm or upper body. It's applied once a day. Gels, androgel and testim, come in packets of clear testosterone gel. Testosterone is absorbed directly through the skin when you apply the gel once a day. Androgel, Axerone, and Fortesta also come in a pump that delivers the amount of testosterone prescribed by your doctor. Natesto is a gel applied inside the nose. Testosterone gels can have an odor that at times can be strong. Testosterone can also come as a mouth patch called Striant. It is a tablet that sticks to the upper gums above the incisor. The incisor is the tooth just to the right or left of the two front teeth. It is applied twice a day. It continuously releases testosterone into the blood through the oral tissues. Injections and implants. Testosterone also can be injected directly into the muscles or implanted as pellets. Your body slowly absorbs the testosterone into the bloodstream. So why not a simple testosterone pill? Oral testosterone is available. However, oral testosterone can have negative effects on the liver. Using other methods, such as skin patches, gels, orally disintegrating tablets, or injections, bypasses the liver and gets testosterone into the blood directly. Risks of testosterone therapy. Testosterone replacement therapy side effects most often include rash, itching, or irritation at the site where the testosterone is applied. However, there is also evidence of a possible increased risk of heart attack or stroke associated with testosterone use. There are a few health conditions that experts believe testosterone therapy can worsen. One is benign prostatic hypertrophy, or BPH. The prostate grows naturally under the stimulation of testosterone. For many men, their prostates grow larger as they age, squeezing the tube carrying urine. The result is difficulty urinating. This condition, benign prostatic hypertrophy, can be made worse by testosterone therapy. A link to BPH discussion appears at the top of this video. Prostate cancer. Testosterone can stimulate prostate cancer to grow. Most experts recommend screening for prostate cancer before starting testosterone replacement. Men with prostate cancer or elevated prostate-specific antigen should probably avoid testosterone treatment. Sleep apnea. This condition can be worsened by testosterone replacement. It may be difficult for a man to detect this himself, but his sleeping partner can often tell. Blood clots. The FDA requires that testosterone replacement products carry a warning about the risk of blood clots in veins. This could increase the risk of deep vein thrombosis and pulmonary embolism. Pulmonary embolism, or PE, is a potentially life-threatening clot that occurs in the lungs. Congestive heart failure. Men with severe congestive heart failure should usually not take testosterone replacement, as it can worsen the condition. Additional testosterone replacement has side effects, which also include acne and oily skin, lower sperm counts, which cause infertility, which we discussed earlier, shrinkage of the testicles, and larger breasts. Yes, larger breasts in men. So testosterone therapy must only be considered in consultation with your physician. Not all men with low T should be placed on testosterone replacement therapy. Well, I hope this helps. Have a good day.